Okay, so this is the MRT, the Matrix Regeneration Therapy, third generation by Dr. Bodo Kohler. As you can see, I just turned it on and it's making a lot of noise. And this is the headpiece for it at the top of the table where the patient lies their head right here. So, first of all, you see a lot of fancy lights and you're hearing a lot of noise. So the first part, we're just going to break it down. There's many components to this technology, and they work synergistically in order to be able to have the optimal results. So the first thing that occurs has a pulse synchronous vacuum, which gives release to the capillaries and improves the microcirculation and the lymph drainage. The second thing is this rhythmical vacuuming massage, which supports the lymph flow and increases the order of the tissue. The third thing that you can see here is this red light. So this red light is at 630 nanometers, and it penetrates deep to the cytoplasm and the mitochondria, which allows for the increase in energy levels. And then you have also, through this wand, the release of direct current, which is duly modulated, which acts as an electron deliverer in the absorption spectrum of the membranes, which means it floods the body with electrons, which alkalinizes the body indirectly. And then you have the pulsating magnetic field, which is actually right here also. And this stimulates the ionization energy, which is necessary for the transportation of all substances to be absorbed across the tissues, or into the tissues, I mean. And then you have the signal processing, which occurs in the actual machine, where the person is, this part of the machine is put on the person's back, and then the information from their back is taken into the machine, and then once put in the machine, it's processed, and the device transforms any pathological signals that it picks up from the person's treatment through this wand, and then it makes them more physiological. So that's pretty crazy, I would say. Also, it has a transmission of the four regulators of cell metabolism, which creates a balance in the system. And also, there's a transmission of additional information from the white noise frequency bands for the support of detoxification and metabolism, especially for phase 2 detox pathways. So it actually gives frequencies back through this wand that are supporting the liver detoxification at the same time. And then it also has biofeedback of the disturbance fields, which helps the corresponding brain area. So what it does is the wand takes the information in, and again, it takes the information, it processes it, and then it outputs it in this little contraption here that works in the head, which is directed at the brain. So what it does, it breaks that pattern that the brain has, the central nervous system has with the rest of the body, in order to shut off that inflammatory response or that negative message with the rest of the body, so it can be so the body can regulate itself in the end. So that's just some of the basics of what we see here. And down here, of course, you see the pump, and that's the pump that's working at synchronicity with the actual pulse rate, where you put your finger in here. This takes your pulse, as you can see right here. We have it on automatic right now. Once it takes your pulse and synchronizes it with the physical pumping in here. And this is actually creates suction. And in a future video, we'll actually watch and we'll see an actual treatment in fast time, just so you can get a better idea of what it looks like when we're treating. But overall, we can increase the intensity on this side of the different vacuum, and also the flooding of electrons. And on this side, we can choose if we want to take off the magnetic field therapy or the photonic therapy, which is the red light here, or also if we can stop the electrons being flooded in, or if we want to stop the suctioning. In the bottom part here, as you can see, we have detox and regeneration. In general, it goes back and forth between detoxification and regeneration in terms of the organs that it goes after on the back. But in this case, we have it set on just detox. And then lastly here, we have the test button. The test button just means that if the person's heart rate is not on the average level, if it's too high, tachycardia, which may be over 90 or 100 beats per minute, or very, very low, below 60 or 50, then what we do is we try to use a test kind of a heart rate, which is around 70 beats per minute, in order to have the proper synchronization and application of the therapy in terms of suctioning on the back. So I hope that helps you a little bit in terms of understanding the basics of what it is. But like I said, in the future, we will look into more detail and we'll show you how it looks to have a physical therapy with the MRT on a person. Thanks for watching.